Hi, I'm Dr. Pirko from Ideal Plastic Surgery, and I would like to talk to you today about injections for weight loss. As you know, these have been around for at least 5 years in the media, and there's lots of famous people who have lost lots of weight and have been able to keep it off. And then there's people like me. I'm not famous, but I also used it, and I really loved what it did for me. I was struggling with some pounds that I put on, not all at once, but slowly. I'd gained 30 pounds over my normal weight. And the idea of dieting was just killing me. Because let's face it, when we have to lose weight, at least in my case, I wake up hungry and I go to bed hungry, and all I can do is in between think of food. And that's not fun, and it's hard to lose weight. If it was easy, well, nobody would have to lose weight. We would all be skinny already. What has changed? The fact is that we can now control our cravings for food with a small injection once a week. And to be honest, as a physician, I have changed my attitude towards people who are struggling with weight. I hate to say it, but I used to think, like many, that if you are overweight, well, you're probably just eating way too much and not exercising, and it's all your own fault. It's not some hormonal disbalance or something that can be adjusted with a small pill or a small injection. Well, I was wrong. It turns out that now we do have not one, but several medications that have proven us wrong, because the difference is actually what our body is communicating in order to make us want or need more food or not. There are two medications that we have here at Ideal Plastic Surgery. We have Semaglutide and we have Tirzepatide. I myself used the Semaglutide when I wanted to lose 30 pounds. I had several patients who were starting to ask about these medications, and I figured, well, I don't really know a lot about it. Let me find out a little bit more, and let me tell you what I found out and how it went for me. The semaglutide is a GLP-1 analog. This is a product that is produced by our own body when our intestines are full, when there is no more room to communicate to the stomach and to the brain that the stomach does not need to empty anymore into the intestines, and that the brain does not have to tell us that we need to eat more, that our appetite can be suppressed. Well, guess what? It works. This product was initially only approved for people who have diabetes, but the experience was so overwhelmingly good that the FDA realized this can help people who are struggling with weight safely manage their weight. When you use one of these injections once a week, your intestines are feeling full, your stomach is no longer getting emptied quickly, so there is not this constant feeling of hunger, and your brain is no longer feeling appetite. And I can tell you it works. I put on the first shot. In that first week, I lost a lot of weight, and I continued to lose weight as long as I was doing the weekly shots. I was no longer hungry. I was no longer having cravings. I was no longer wanting seconds. Instead, I had to be reminded that I hadn't had any food all day. I would wake up, just have a coffee, go to work, not eat all day because I wasn't hungry, go home, and then had to be reminded that we hadn't had dinner yet. So I've never done a diet that was easier, and I will never do a diet without these injections again. If ever I gain weight again and I feel like I need to lose 10, 20, 30 or 40 pounds, I will again use these injections so I'm not feeling hungry all day, so I'm not feeling like I'm starving while I'm doing a diet. Let's talk about the side effects. Anywhere between 20 and 40% of patients are going to have some sort of side effects, and I had all of them. The side effects are usually mild, and it can be a little bit of gastrointestinal unwell feeling. I had a little bit of crampiness, a little bit of bloatiness. I did have diarrhea one day, and then at the end of that first week, I had a little bit of constipation. The first 2 days, I had a little bit of nausea, and one day I almost thought I was going to throw up, but I didn't. Most patients are going to experience something like that. Now, some patients, probably 1 in 100, are going to feel severe side effects, and they will have excessive abdominal pain and cramping. They may throw up, and they may not be candidates for this. Not everyone is going to do well with semaglutide, but the great majority of people do just fine. We can help manage these by making some behavioral changes. I noticed that I was filling my plate in the same amount that I used to. I just felt way too full and nauseated, and I learned to fill it up with much less, and I was feeling fine. Some patients ask us for a little bit of anti-nausea medications that can be dissolved under the tongue, and that can also help. Sometimes we have to adjust the dose, and we tend to start with a half dose for the first 2 weeks, and then we move on to a full dose because it's better tolerated that way. But there are some patients where we maybe kept them on the half dose a little bit longer, or on occasion even went down to a quarter dose until they adjusted. If you feel that you're having some side effects that are a little bit harsher than what you were expecting, which would be unusual, just send us a message or call us. There is always a doctor available here at Ideal to deal with any questions that you might have. Let's talk about how much weight loss we are to expect. Well, there are patients who've lost over 100 pounds. Now, most of us don't need to lose quite as much. You may want to lose 20 to 40 pounds. That's pretty typical. But we do suggest that you don't lose them too quickly. Why? Because if you went too harsh and took advantage of the fact that you're not hungry, yeah, you're gonna lose a lot of weight, but some of it is not going to be just fat. You will also lose more muscle. And we don't want you to lose too much muscle. We want you to lose fat. A healthy goal of weight loss is probably between 1 and 3 pounds per week. The first week I lost like 6, but some of it was probably water. But I adjusted by increasing the amount of protein that I was taking in every single day. I started buying these little protein shakes that are available everywhere and having one midday, whether I was hungry or not. I started having a little bit of early morning protein snacks like boiled eggs or these little egg white sous vide things that you can buy at Starbucks or at Costco and many other places. I did have a little bit more awareness of the fact that I was losing weight too quickly, and I purposefully slowed it down. So to lose 30 pounds, it took me a total of 3 months, but it was done in a safe way that wouldn't lead to wasting, that wouldn't lead to potential complications. We are going to monitor your weight loss, and let me warn you, I have had patients that I took off their injections. Why? Because they were not eating. You can't take advantage of the fact that you're not hungry and just stop eating and then show up here after 4 weeks and have lost over 30 pounds in 4 weeks. If you did that, I won't feel like it's safe to continue giving you the injections, and I will stop. But as long as you lose a reasonable amount of weight and communicate with us clearly, I think we can reach great weight loss goals together. Sometimes patients need to have their doses adjusted. We caution patients not to ask for upping the dose too quickly because the half-life of the injections is about 2 weeks. So if you get a dose every week, it's starting to build up higher and higher in your bloodstream. It is true that after a while, your body gets a little bit used to it, and that initial feeling of being unable to eat at all goes away, and you start having the occasional craving. But that doesn't mean that we should quickly increase everyone's dose, and instead we recommend doing it slowly. Let's talk about what to do once you have achieved your weight goal. Well, in my case, I had lost 30 pounds, and my first thought was, I'm just gonna stop this right away. But that's not what is recommended by science. Why? Because there's a higher chance of having some bouncing back and regaining the weight. That happens because when we lose large amounts of weight, our body feels that we are in starvation mode, and it tells our metabolism to slow down. It acts as if there was a famine going on. There is no food, so therefore we must not burn much in terms of calories. That's why it is important to also incorporate exercise into our daily routines and stay active. Because if you are on famine mode and decrease your metabolism, well then the minute you start eating normal again, you're gonna gain weight quickly. So therefore the recommendation is to make an effort to go on a walk, go to the gym, exercise, and once you reach your goal weight, consider staying on maybe a much lower dose, half dose or even a quarter dose for another 2 months or maybe even 3, so your body slowly can adjust and you don't end up with bounce back weight. What kind of food are you supposed to eat while you are using injections? Well, high protein, high fiber, high nutrient, vegetables, fruits, lean proteins of any source. If you're a vegetarian, you can use vegetarian proteins. If you're vegan, you can find a vegan source. If you like to eat meat, that's fine as well. But you need to have a balanced diet while watching the total caloric intake. We certainly do encourage you to take advantage of the fact that you have less cravings and avoid sugars, alcohol, high carbohydrate meals, because those are going to make it harder for you to lose weight. We want you to be on a diet, but it has to be a sensible diet. I hope this was helpful, and I want you to know that we have a team that is available to help you navigate this new route of losing weight. It has helped many of our patients, and it has helped many of our own team members. I have lost 30 pounds. A few of the other doctors have lost quite a bit of weight. Several of the other team members have lost and continue to lose weight with injections. If you do well with semaglutide, that's great. If you don't do well with this first medication, we do have a second one available for those who don't tolerate it, Tirzepatide. It is a stronger medication, but surprisingly, it is better tolerated by those who don't tolerate the first one. Or it is indicated for those who have very high goals of weight loss. With semaglutide, typically we see patients losing about 15% of their body weight with ease. With Tirzepatide, we can lose 25% of the body weight. So there's different goals and different abilities for each patient. Talk to us. I think good communication is the key for a successful weight loss, and we are happy to have you here at Ideal Plastic Surgery.